And we are live. Good afternoon, everyone, and welcome back to yet another episode of the Chiromo Hospital Group, live on Facebook, live on YouTube and LinkedIn. And we are honored to have all of you here with us today. Thank you to everyone who has joined this conversation live. And a special thank you also to our panel here with us today. Just a moment, just hold on and bear with me. Great. So my name is Pendo Ochola. I am a hospital psychologist from Chiromo Hospital Group, and I will be hosting today's conversation. With me today, among other panelists who are bound to join us as we carry on with this conversation, is Dennis Musyoki. Dennis is a peer counselor, a peer mentor, a mental health champion, and Pony University Peer Counselors Club chairperson. Thank you so much, Dennis, for joining us. Would you like to introduce yourself to the audience?
Thank you so much, Pendo, for the warm welcome. Yeah, my name is Dennis Musyoki. I'm a nursing student at Pony University. I'm a peer counselor, a peer mentor, and also the current Pony University Peer Counselors Club chairperson. Basically, what we deal with is matters relating to student mental health issues and counseling, and also peer mentorship. So thank you so much, and I'm happy to be part of this great conversation.
Thank you so much, Dennis. And today's conversation, as it reads down below there, we're going to be focusing on finances and mental health. And having that you're just the two of us, it's going to be more of like a interviewing kind of session today. So I'll just start right on with the first question. With the current state of the country, the current state of economy in the country, how do you think this has impacted on the mental health of Kenyans today? To you, Dennis?
Pardon, Pendo.
No problem. So the first question was, with the current state of economy in the country, what impact do you think this has had on the mental health of the people of the nation, of Kenyans?
Okay, yeah. Currently, the state of that is the economy of Kenya is quite hard for for the Kenyans. A case example is recently we heard of a man who kind of shoplifted in one of the major supermarkets in the country, and this person was taken to the court, and upon trying to explain himself, he said that he was desperate, and he had a sick, I think, a young child and a sick, I think, wife, and this is what led him to doing the act. So basically, what we can pick from that is that currently most of the Kenyans are facing quite a hard time in terms of the financial uh, obligations. Some have various responsibilities such as families, young families. Some are orphans, and all these issues, if one can really look at them keenly, if maybe somebody is at the top government offices making decisions, out there you can really pick some key issues that Kenyans are really suffering currently.
Thank you so much, Dennis. And perhaps we'd like to narrow down to your own personal experience. How has it been for you, and how are you coping with regards to the impact on your mental health?
Okay, personally, I'm a student in one of the big universities in the country, Pan University, and students have various sources of income. Sometimes you find from the help that they get from personal businesses, such as doing businesses, selling tumba and stuff. So personally, I've been able to, in my own part, I've been able to save a little here and there, and the I try to do some artwork. So from this artwork, sometimes I'm able to get something to top up in to help me in my daily activities, and also I'm very cautious on my spending habits. I try to have a budget like for every week, and like ultimately every month, and out of that I can save and plan ahead for the future, and also draw the possible disasters, or the possible events that can warrant me to spend a lot. So out of that, I'm able to be cautious with my spending and be careful.
Wow, I'm picking three things from your response. One, using personal interests to try and get financial gain from that. Two, I'm picking using or rather applying healthier spending habits, so budgeting and the likes. And three, I'm hearing you preparing or rather anticipating for situations where you might need to use money abruptly and bracing yourself for that. So thank you so much, Dennis, for that. And for most importantly, I think even getting the perspective of a student currently. So before we even go further along in this conversation, perhaps I'd like to um, maybe ask you to tell the audience, first of all, what is the relationship between finances and mental health before we even move further along from that?
Okay, the relationship between finances and mental health, from a student's, that is a university student's perspective, basically is that, with money, some people say that money is everything. Some say with money you can buy everything. You can get access to all what you want in life. So basically, you find if you are well satisfied, that is in terms of financially, that is, you are able to be, as in you're able to access, that is the basic happiness, and access the basic things that you need, that is clothing, food, housing, and all those issues. So generally, if a person is facing a financial crisis, most of them, especially the university students, most of them end up depressed. Most of them end up having the suicidal tendencies and thoughts. So out of this, we can really pick that if a student, a university student, is facing those hard financial issues, then the his or her mental health is likely, very, very, very much likely to be affected, and as a result of that, learning for that student will not be good enough.
Thank you so much, Dennis. And what I hear is the impact of having a challenge when it comes to finances and how that will affect how we access the basic things that we need, and then how that will contribute to some of the factors that will lead to challenged mental health. But how about in the flip side of it? What relationship would or what impact would ill mental health have on one's finances?
Okay. The effect of one's ill mental health will have in one's financial status. Okay, sometimes you find mostly there are some underdiagnosed mental health disorders in the society. You talk of uh, personality disorders. Some of them like histrionic personality disorder, borderline. You know, some of these disorders, you find they are kind of, they try to be kind of showing off. You find somebody can go to a supermarket. A university student can go to a supermarket or a market and try to purchase the things that are in the market, those that are shiny, the new things in the market, and hence this person will end up spending a lot that than he or she had planned. Yeah. Then another way it can affect one's finances through depression. You hear students, they say that I am taking alcohol or I'm into drugs in order to kill, in quotes, stress. So out of these issues of killing stress, you find somebody is really spending in his oral financial finances that he or she has, and this ultimately makes this person even more depressed because you are spending more money, and it's like you don't know how to control that condition. So ultimately it's just progressive, and then ultimately it's a sham.
Thank you so much, Dennis. And what I gather from the two past responses is there is a relationship between the two, in that mental ill health could contribute to challenged finances, but at the same time, challenged finances could also contribute to mental ill health, looking at the different circumstances surrounding it. So thank you so much for that. And having that financial stress has this potential impact on our mental health. How then do you think we can cope with financial stress?
Okay. How can we cope with financial stress? One, I think in our country right now, there's something that the Kenyans generally are not taught well enough. The issue about our spending. So you find maybe somebody has got his or her salary at the beginning of the month, but by the time that month inafika katikati, it reaches the center, this person has already spent a lot of this salary. So we need to be educated about the importance of planning for the crisis. Maybe COVID was there to teach us a lesson. Maybe another crisis will come in the future. These are the lessons that Kenyans really need to be educated and taught about. Our young people, you find most of them don't really know about the importance of saving, the importance of having something as a backup for the future. So once crisis and other issues come, unexpected emergencies come, you find this person cannot really be able to address that issue because he or she has not saved enough for the future. So as a nation, I think we need that adequate and vigorous training, even if like in the universities maybe they can try to incorporate it in some of the courses, the financial courses. The lecturers can try it. It's kind of an youth empowerment. You empower the youth and try to educate these young people to be able to learn how to save, because ultimately if you don't teach the young people, these issues project later in life. Even look at our government, for instance, the way it is spending a lot of debts. Maybe it's the issue of the young people. Maybe the people working there don't really know how to deal with with the Kenya's as a nation finances. So we need to have these issues being told and aggressively being put in place so that we can learn from them. And also, uh, even in our families, the father, the mother, that is a basic family unit. There is need for the children to be empowered and to be guided on the importance of maybe starting a small savings for the children. Maybe you give the child a business to do. You're trying to teach that child on how to be self-reliable and self-sufficient. So through that education to the young person, to that young boy or young girl, you ultimately plant a good seed that if I can save something for the future, then I'll be able to purchase this, I'll be able to cater for my financial crisis. And also for those people that are at the they are already hit by the crisis of the financial, I mean the financial breakdown, that is, it's good, like the people that are in the healthcare, like the like yourself, a psychologist, and also the nurses, it's good that you uh, try to teach them through maybe psychotherapy, behavioral therapy, and yeah, you try to teach them on the importance of saving, how to do saving, yeah, how to delay gratification, basically, and be able to cater for the future. Yeah.
Wow, thank you so much, Dennis, for such an elaborate response. And some of the things that I've picked out from your response is one, information and empowerment. As much as you probably have not been exposed to that through the systems that you've gone through, that doesn't mean that you don't have an opportunity to utilize the resources available to us. For example, the internet, to learn about financial management. But also something that I had more from a preventive side of it is, empowerment and empowering each other straight from the basic level of the community, and that is the family. So children to be taught about responsibility when it comes to finances, to be taught to understand the value of finances, to be taught how to generate and to manage. So thank you so much for that. And also something that you mentioned is seeking out professionals who have studied to how to go through finances. So if you're able to access a financial advisor, if you're able to access perhaps even in therapy to explore your relationship with money, some of these things will be important for us to be able to learn how to to manage our finances better. So thank you so much, Dennis, for that elaborate response. And it takes me to ask you a more personal question, or rather to prompt for more personal experience from you. What is the best financial advice that you've ever gotten that changed your life and that you would like to share with the audience today?
The best financial response that I've ever gotten in my life, mm, maybe it's important. Okay, it's from my dad. Yeah, he taught me that it's good if you get something, don't try to, as a young person, don't try to show off. I think he taught me this when I was in high school. During the time he was giving me the pocket money. Yeah, so he taught me it's good. Do not try to show off that you have enough. You have a lot of money. Try to save for the future and only take what is necessary. Don't overspend. Don't be moved by the big shoppings and yeah, huge spending. So it taught me about saving and the importance of delayed gratification. Yeah.
Thank you so much, Dennis, for that. I wouldn't say that this is advice that I have directly been given, but this is something I went, or rather, I came across on the internet, of course, and someone who mentioned if you can't buy something twice, then you probably can't afford it. What do you think about that?
Okay. If you said if you can't buy something twice, you can afford it.
Then you probably cannot afford it.
Yeah, most probably you cannot afford it. So it's good to look at generally your potential in maybe purchasing that thing. Like for example, in campus, you find there's a tendency of students. Somebody has a huge fee balance, he gets the help, and then this person opts to buy a TV but he has a few. You see now that's yeah, like it's deviating from the needs that that person has. So it's good also, like you have just said, it's good to check maybe the priorities that somebody needs in terms of spending money. Yeah.
Thank you so much, Dennis, for your opinion on that. Again, it's that was just more of like an opinion-based part of this conversation. So, are there any financial advisors that you are aware of who can guide us through financial decisions? And this is just to empower the public with resources that they will require. Yeah, and do you know where one can get professional help on matters mental health? From your to the best of your knowledge.
Okay. Uh, in my setting, like the university student life, I think every university has a student counselor office. Yeah. So it's important if maybe somebody has an issue with their spending, maybe he or she could consider maybe visiting the student counselor or even the dean of students and try to listen from their own perspective and how they view financial spending, and also about matters saving and finance. There are some nice banks in Kenya whereby you can go and approach them and they teach you about saving in circles, saving in matters shares. So out of that, like for example, I'll mention Equity Bank. Equity Bank have a good, uh, I'd say a good system of guiding someone on the savings and how to do savings from their bank. Also KCB. So maybe from the banks and also from good qualified student counselors and the mental health providers. Out of that, a young person can learn more about financial management and saving.
Thank you so much, Dennis. And what I hear is we ought to take advantage of the resources that are around us, some which are very readily available, to try and learn more, to try and empower ourselves with information around financial management. And I would also like to mention that in line with our global initiative that is hashtag Tufunguke, I would like to encourage or to challenge everyone who is watching this. If you're at a point where you're going through a challenge and you feel like it's a little bit overwhelming, a little bit out of your capacity to handle, it's okay for you to talk to someone. It could be someone who is older than you, it could be someone who is younger than you. It could be a peer, someone at work. Feel free to open up and talk to someone about it, to funguke about all the challenges that you're facing, so that we get to hear an outside perspective of what we are going through. And probably out of that initiative, out of that seeking this conversation, you might be able to get solutions to the challenges that we're facing, probably through professional advice or just through life experience. So this is more of a challenge to the audience. As much as you're opening up about our own experiences, our lived experiences, we can also open up to the people around us, to even get solutions to what we are going through. But in addition to that, I would also like to let the audience know of our toll-free number, which is 0800 220 000. And you can call this line to speak to one of our psychologists. This is not going to be charged to you in terms of airtime, but it's going to be a free call where you can speak to one of our psychologists if you'd like someone to talk to. If what you're going through is overwhelming. So this number is available 24/7, and on the other end of the line, it's going to be one of our psychologists. So feel free to call us through our toll-free number. But otherwise, I'd like to thank, most importantly, Dennis, for joining this conversation and being here with us alone, despite us expecting more panelists. Thank you so much for giving us your perspective on finances and mental health, most importantly, from a student's perspective. And we also would like to appreciate the work that you're doing in your own space, not only to empower people, but specifically when it comes to matters mental health. So we thank you for the work that you're doing, and we appreciate you for that. For everyone who has been watching this conversation live, thank you for following through this conversation. Feel free to join us next week on Monday, where we're going to be having a new week. And for our Mindful Mondays Chit Chat, we will be talking about adulting. So feel free to join us next week on Monday, and also next week on Wednesday, as we have another live discussion on the same. So I'd like to send a special thank you to everyone, and to Dennis specifically, as we come to the end of this conversation. Dennis, perhaps you'd like to give a parting shot to the audience?
Okay, so maybe I'd like first of all to appreciate your organization, that is Chiromo Hospital Group. It's really a nice initiative that you are doing, and a nice platform that you are trying to carry out for young people, and to carry the message of hope and mental health. You know, this issue of mental health, it has been long neglected in our society. So the work that you are doing, it's really a great job. And what I can tell the audience, it's good to take advantage of these things that we manage and get them for free. The message about financial financial instability and maybe mental health, the relationship. So it's good for young people to really be actively involved in matters mental health, and try to move toward a society that recognizes the space of mental health, and how the society can put in place measures to ensure that the society generally is healthy from all the issues of mental health. So I'm very humbled, and I really wish to appreciate you, Pendo, for the opportunity and for the engagement platform. Thank you so much, and may God bless you.
Thank you, Dennis. On behalf of Chiromo Hospital Group, let us all work together to break the stigma on matters mental health. Tufunguke.